Hey, Courtney, can you hear me okay?
Yes, we are, and we are ready to get started. Good morning, everybody. Thank you for joining us today. We know we may have a few more popping on here as we get going. We are happy to have the team of experts over at Augusta Health joining us this morning for a COVID-19 update. Mark LaRosa and I have been talking about some ways to share information with the community, things that are going on in our community locally, how Augusta Health is working through this crisis, and things that we can all be doing to make our area a lot less affected, I guess, by this crisis right now, especially as we're working into summer vacations, looking at school starting. So we are really thankful that they were able to join us this morning and give us some great information. So without further ado, I'm going to turn it over to Mark LaRosa. He is their VP of Business Development and also on the Chamber Board, which we're very thankful for his service there, and he's been a fantastic resource for us. We have been calling him and texting him and emailing him all kinds of things over the last few months, and we just really appreciate all the help that we've gotten from there. So Mark, I will turn it over to you and your team. We will be recording this webinar to share later. And if anyone has questions as the presentation goes, feel free to use the chat feature and we'll be keeping an eye on that. So Mark, take it away. Thank you.
Okay, thank you, Courtney. Appreciate the Chamber taking the time and to set this up and to allow us to use their website here or web technology to be able to do this. Also, appreciate everybody who's taken the time actually to listen to us today. You know, as we watch the COVID numbers and we work daily to take care of our COVID patients and in the community, we often think, boy, we need to tell the community about this. We need to give them information about the number of positives. And this is a great forum to be able to do that. And we're always looking for ways that we can get the message out. So thanks to the Chamber for recognizing this need and bringing it to our attention. Just a couple reminders today. Please keep your phones muted or your devices. We will have opportunity for questions and answers. If you want to ask a question, certainly there's the chat box. You can do that also by simply unmuting and asking a question. But we'll try and prompt that throughout the day. Also, let me introduce some of the folks who helped pull this together. From our team, there's Nicole Simmons, who did a phenomenal job in pulling together the information that you're going to see today. She had to pull together the thoughts and ideas to try and tailor this to meet your needs. And so kudos to her for helping pull this together, and Lisa Schwank from our Public Relations Department, who provided advice to us in terms of making the message appropriate for you. Also, we've got a panel of experts here that I'm going to introduce to you in a minute, but special thanks to them for a lot of their ideas and research that they did with some of the information that they're going to provide to you. So let me continue on. What we're going to do to start out is just I'll level set with the information on the statistics and the number of cases in the market. I want to review with you a little bit of Augusta Health preparedness and also do that in a way that helps provide you with ideas maybe for your organizations. And then we'll take a deeper dive, and that's where we want to spend the bulk of our conversation, is really understanding COVID-19 and how this affects you and your organizations, and hopefully we can provide you with information to help you take care of your employees. So let me introduce to you our COVID healthcare panel. We have Dr. Allison Baracco, who is the Medical Director of Infectious Disease. Yes, thank you for waving, Dr. Baracco. I'll ask them to wave. We're all kind of in this bubble here. He was the Medical Director of Infectious Diseases and also Chairman of the Infection Control and Prevention Committee for Augusta Health. We have Dr. Clint Merritt, who is Chief Clinical Officer for Population Health at Augusta Health, and Dr. Laura Cornegie, who many of you know from the Virginia Department of Health. She is the District Director of the Central Shenandoah Health District and also currently acting as District Director of Roanoke City Health District and Allegheny Health District. And we're so fortunate to actually be able to have all three of them here at the same time to provide this resource to you. So let's begin with the current situation. This data I'm going to share with you is the kind of data that we look at on a regular basis at Augusta Health to monitor the prevalence in the community and also help us be prepared. At the state level, there are 80,393 total cases. We've exceeded the 80,000 mark. 7,351 hospitalizations, and unfortunately 2,051 deaths. As you know, this information you can find on the Virginia Department of Health website. You can see from the map some of the hot spots. Those are the darker areas in the state. If you look at the graph to your right, you can see the daily trend line as far as when we peaked. It looked like we peaked as a state early in May, then we came down in June, and then have started to climb in July. And that climbing, there's probably a direct relationship with that climb related to reopening and the July 4th holiday. So we're on a bit of a roller coaster in Virginia. If we dive down a little bit further into the Northwest region, that's the region that we reside in, where the Central Shenandoah District is. You see a similar curve, although we probably peaked about a week or two after the state, and then had a decline in June, and also had a somewhat of an increase also in July. And we're going to talk a little bit more about that. You know, I don't have the statistics here or the chart, but if you looked on the eastern part of the state, you would see that the tide water in the shoreline area in Virginia Beach are actually spiking right now. And a lot of that is also due to the reopening that we're seeing. Dr. Kornegay, is there anything that you would add at this point that related to the statistics? Or?
Yeah, I think just reopening, getting more people together in larger groups has contributed to the climb. You know, people are traveling to hotspots as well. A lot of beach destinations have become hotspots for transmission. The other thing that's somewhat affected it too is just increased testing. So that's a good thing. We're identifying more cases, but we definitely need to keep our guard up, especially as we start to reopen schools in the next month or so.
Right. And that's a good point, and we're going to be talking more about going back to school later on. Let's take a little closer look at the SAW statistics. This first chart here is actually an Augusta Health chart developed by Dr. Baracco, and it helps us determine the number of cases that we believe, or estimate the number of cases that are in the SAW at any one time. You know, you have cases that are introduced every day, positive cases, but people are symptomatic for approximately 10 days. And so for 10 days, we keep them in this data, and it accumulates, particularly if you have an increase in the number of positives, as you see in the graph down below. So the top chart is what we estimate is the number of prevalence cases in the market. It's averaging around 89 to 90 patients a day in our community. And the positives, we've had a slight increase. Now, I don't want to put too much weight into it, but the last few days have been good, and that's all I will say. You know, we look at the numbers on a daily basis, and we try not to get too excited when we see the good days, but indications are moving in the right direction, and I'll leave it at that. The hospitalizations at Augusta Health are really interesting because they've been relatively flat. So as we've had this increase in our community, we've been relatively flat with our daily census of cases, between 5 and 10 cases a day. Yesterday, I think we were at 7. And this has been going on for about 2 months now. So what that tells us is that the cases that are being identified are more outpatient cases than inpatient cases. And that's actually good news because those are patients that can be cared for at home. And they don't have a severe case that they need to be admitted to the hospital. That being said, when we see this trend going up and we're flat, we're watching that very carefully because we're vulnerable. And if that prevalence number increases at a rate of, it doubles in more than 72 hours, that sends a flag up to us that we could be seeing more admissions coming down the path. Real quickly, if you break it down in a comparison of where we are today in July on a daily basis to June, we're averaging about 9.7 cases per day. In June, the SAW was averaging about 4.7. So that's 5 compared to 10 cases. We're double number of cases per day. Augusta Health tests about 2/3 of all the cases in the SAW. And so that's what the red numbers portray. And lastly, I just wanted to provide a statistics. Often we were asked, so which population is being most affected by the number of positives? Are we seeing anything in the numbers? And interestingly enough, when we looked at this in July as we were seeing an increase, we had a pretty even distribution of the number of cases in each age cohort, with the exception of 0 to 18. And that continues to be the lowest age cohort. But all the others, 19 to 30, 31 to 45, 45 to 64, and 65 plus are running around 25% of the population. I'll stop at this point. Is there anything that any of our panelists would want to add around the statistics? Okay.
Part of the reason why we'll learn more about children, I think, pediatrics or the age group 0 to 18 have not been tested as much, and we may be seeing more testing as schools begin to reopen. I know that's a big question probably looming in the back of some of the people on this panel's mind. But overall, it appears that children aged 0 through 9 tend to transmit it less. We're learning more throughout the country. If you have a high prevalence of disease, some of those children are getting it most likely in their home setting. There have been some daycare outbreaks that have been in high incidence states, but I know children remain on the brain of a lot of people as they are our future, and we're learning more about that. So when you look at our data with pediatrics, you're really not going to see, many have not been tested. The reality is we don't know how many have been affected, but the reality also is that many of them are, if they are infected, are asymptomatic carriers.
Okay. Thank you, Dr. Baracco. So let's talk a little bit about Augusta Health. And there's 2 reasons that I'd like to share this information with you, and I'm going to go through it relatively quickly. But one is so that you know that Augusta Health is prepared to take care of you and your employees. We have been watching this consistently, even went back into February and March, and so we believe that we're very prepared for the pandemic. But the second reason I want to share this information with you is from an organizational perspective. As you consider your organizations, perhaps there's concepts within some of the things that we're doing that you may find helpful in your organization. For example, there's some safety ideas here, planning ideas, communications ideas, and others that you may want to adopt, and we're happy to provide follow-up later on around some of the things that we're doing. So first of all, as we're reopening and getting prepared to take care of our clients and our patients, we have a clear plan about how we were going to go about doing that. And we've worked our way through that phase and plan, so we're totally reopened now. But first we started out taking care of the patients that made the most sense and the patients that we could get our arms around, and those with radiology, cardiology, outpatient therapy, outpatient visits. And then we moved into outpatient surgery, which required some pre-op testing. It was a little bit more complicated. And then we began doing inpatient surgery. And again, we added more complexity to balancing the management of our COVID patients along with our patients who have been pent up for so long. And now we're in phase 4. And phase 4 is really trying to take care of all of that pent up demand. So we're trying to add more hours to the schedule, add more OR time, and in other ways try to make ourselves as accessible as possible so that we can handle the existing patients that we want to take care of, the 99% of the population, along with the 1% of the COVID patients. So when we started down this path, we had clear priorities about what we were going to do and how we were going to do it. Our first priority is always about safety. And safety for our employees and safety for the people that we provide services to. Second, we needed to make sure that we have adequate resources and supplies, and these are PPE. And so a lot of these supplies we had, but we need more of them because we need to protect ourselves, all of our employees. As you can see, we're all sitting here with masks, and so we're using more PPE than we typically would. Third was to continue to work with the community and integrate into the community so that we can begin to control the amount of COVID in the community. And ways that we've tried to do this is, one way is to identify the hotspots. Where are the high-risk areas? And think about that from an organizational perspective. You want to look at your organization and try to identify the high-risk spots. And we're going to talk a little bit more about that when we get into the panel discussion. And then also one of the things that we tried to do is make sure that the community had the resources that they need if they couldn't get out, such as food. And so we've worked with a number of organizations to help, for example, home health patients get the food that they need. We've also upped our game in communication. We wanted to be concise, consistent, and correct about the information that we've been providing to the community about COVID. And then we wanted to make sure, fourth, that we were supporting each other and facilitate communication internally in a supportive way. Mary Mannix, our CEO, has done over 50 direct emails to over 2,000 employees 50 times since we started this process. She was doing it on a daily basis, and now we're down to once a week. But still, that direct communication is essential for employees. And we've had 14 town hall meetings also to help try and bridge that communication gap, virtually like we're doing here. And lastly, we wanted to make sure we're providing care to all patients, all of our customers. And we recognized that we had to balance the balance between COVID and our routine patients. Just so you know that we have the resources from an inpatient perspective. We have 14 beds in our respiratory care unit. We have 14 beds in our ICU. And by the way, when patients are in those units, they are isolated separately from other patients that might be in the hospital also. The respiratory care unit is nice because it's actually a separate unit that we converted and dedicated just for COVID patients. We also have the capacity for 41 ventilators if we used all of our anesthesia machines. So we feel pretty good about where we are and having our inpatient resources. We also have 11 isolation rooms in our ER, 58 negative pressure / isolation rooms throughout the hospital. Let me just note there that our facilities department had to convert some regular rooms from regular rooms into isolation rooms. And the way they do that is they add negative pressure, which means ventilation systems needed to be installed, but we've upped our game in terms of our capabilities. Lastly, I just want to point out is we have contingency plans should the pandemic ramp itself up again. Where we are now, we don't need to use those contingency plans, but we have an ED alternate site plan where we would set up a tent outside if we needed to. We also have an agreement with Woodrow Wilson to help us manage 40 additional patients if we need it. We also had to look at and think outside the box in terms of how we do business. We couldn't provide care in the same ways, and so one of the places that we re-engineered was our outpatient facilities and our Waynesboro Urgent Care Center. As you might know, you might know this place as our Waynesboro Urgent Care Center, but today it is our Respiratory Care Assessment Center. And we were fortunate that we had a separate location where we could send patients to who were suspect of even having COVID. They had a respiratory problem, and we sent them there to be cared for and assessed. That center today has done over 5,700 visits and tested over 3,500 people, and now we use it as our location for pre-op testing. And so a lot of the testing that's going through there is to prepare people for their coming back to the hospital for their cases. And it's a great place to access testing for the community. We also set up a resource place for patients to call, our customers who had a lot of questions about COVID. And this resource center has helped over 3,000 people through this pandemic, giving them guidance and education. And it's also been a great place to determine if you need to go to the assessment center. And so 30% of those patients go on to the assessment center, and 67 or 2/3 of those patients get guidance and education. That was just adding a layer of comfort to people and giving them direction. Even if they had a slight cough, it was a great place to call and say, is this serious? Do I need to follow up? What do I need to do? And so as you think about your organizations, having a place for people to call, we also have an internal resource for employees, is a great resource for any organization to have. And just one other point on safety, we had to look at making sure that our employees were safe, that our patients are safe. So we've modified our visitation policy to limit the amount of traffic in the organization. We use universal masking throughout the organization. Even when we have meetings, we have, to get like we are today, we will social distance and all have masks on when we're in a conference room. We looked at our patient flow through the hospital. We have separation of respiratory care patients from others. We had to rethink the flow of all of our patients. And we even have experts internally called safety resource officers that are available to the rest of the organization in terms of how to do proper gowning with PPE. Lastly, I just want to mention here that communications, the biggest lesson that we learned throughout this process is you can't over-communicate. There are so many questions out there, and even if the communication seems to lag for a while, then what happens is employees and the community begin to fill in the gaps. And so we wanted to make sure that we were always out there getting the messages that were important. And a lot of that messaging was around social distancing and wearing masks. And as we're watching the numbers, we tried to turn up that communication. So you can see there's a number of forms and methods that we use, but we also focus internally and use our own employees and staff as part of that sounding board. So one of the things that we did is we tried to compare our approach with industry standards. And one of the benchmarks that we used came through Becker's Hospital Review, and they highlighted some of the things that we just highlighted here. And so we felt comfortable that our approach was consistent with industry standards, and that's something else that you might consider in your organizations, is what are others doing? How do we think outside the box? How do we borrow from other industries in terms of thinking outside the box and providing service, continuing to service our customers, but also making sure that we're managing this COVID population. And so I won't go through the list completely here, but we felt comfortable that we were consistent with the industry standards. So let me stop at this point and see if we have any questions before we really take a deep dive into the COVID-19. Okay. Not hearing any questions. What I'd like to really do now is turn the discussion over to our panel and you to have some good discussion around questions that you asked. And so we've taken those questions from the chamber and we've tried to break them down into some great information, some research that we've done to try and make this as informative as possible. So this is the way we're going to try and work this, is I'm going to review the question, and then you'll see some slides, and our panel of experts will begin to respond to those slides and review them. At certain points, I'll try to stop and ask if you have any questions. You can certainly begin to type your questions into the chat boxes. Also, if you really want to ask a question, you can do it through the technology and unmute your phones and ask a question. And then we'll move on to the next slides and the next questions. We've got a lot of information for you, so we're going to try and move through this quickly. And then at the end, we'll try and wrap this up with a Q&A section. So let me review with you the questions that we were asked that we're going to try and cover today. What can our community do better to prevent the spread of the disease? What have we done well locally to prevent the spread? As school starts, are there additional steps parents can take to keep kids safe? How do we keep our employees, families, children, and ourselves safe? And what do we need to do to prepare for another wave of COVID? And so let me begin with the first question is, what can our community do to prevent the spread? And so we may need to hide some of those boxes on the side there so our panel of experts can see the slides. Is there anybody here that is going to take this? Slide this down. Yeah, let's slide.
This is Dr. Allison Barrasso, and I'm going to help answer the first question and use our other experts here if they want to chime in. So the first question is, what can we do better to prevent the spread of COVID-19? And what you're going to see in this list are things that have shown up time and time again, but I just want to highlight a couple of things. So first, we can continue physical distancing as much as possible. As Virginia has moved forward, a lot of people have used that as a cue or a sign, the store that I wanted to go to is reopened, or the restaurants are now open, so I'm going to go because they are open. That's a signal that we can go out and reconvene our normal lifestyles. Safely moving forward, we can in fact participate in some more activities, but it is still essential that we keep 6 feet distancing as much as possible. So if you are going to stores, even if we're going to talk about universal masking a lot, even with wearing a mask, distancing is the second key component. Secondly, we need to avoid parties and large gatherings. These remain high-risk activities. The highest risk is when you have a party or a large gathering where you have people gathering from different states or out of town all coming in together, because that could be somebody in that group could be from a hot spot, bring coronavirus to your party, and then spread it to everybody in the party, and then everybody leaves the following day, or if it's a weekend event, and brings it back to their community. So we know these remain high-risk activities. Know your personal risk. So there are some people that need to remain just as cautious at the beginning as they were or they are today, and that includes people over the age of 60, people with medical problems that weaken their immune system or are morbidly obese. Some disease processes where we see patients have worse outcomes include diabetes, cancer, COPD. And so you need to be extra cautious if you fit in that risk group. But everybody needs to, because we need to protect the people in that risk group. Know your hot spots. Avoid travel to these areas if possible. We've seen on the news a lot about hot spots. Texas, Florida, Myrtle Beach, a lot of beach towns are becoming hot spots. The beach itself is not the risk factor. It's that everybody is gathering there at the same time. And when you're at a beach or on vacation, frequently we get vacation brain and we think that we can just drop our defenses. So be cautious, watch your hot spots. Now they have just put up this nice map for everybody to see. This is from a website called Pandemic Explained. I have found this the most useful and user-friendly. It's from Harvard, their public health department. They have broken down on a map every county in the country, probably using state health department data, to show you if there is a hot spot, or the red is bad, green good. So red are your hot spots. And you can break it down by county. You can see what's happening in our area by color coding, and I love the color coding. It helps me recognize the danger spots. Augusta County has been yellow, but the city of Stanton and Waynesboro are orange, which is closer to red, meaning there was this rise of activity following the 4th of July. Though it's not a hot spot, I think the rise in activity is probably related to people kind of loosening their guard and not wearing masks and having some 4th of July parties. also going into stores without masks. I hope that as the governor has reinforced that we need to do universal masking, that we'll see some changes. There was one more item on the list, if you want to flip back. Okay, so last one, sorry, the universal masking, which we have many slides about to talk about universal masking coming up. Okay.
Okay, any questions from the community?
Hey, Mark, it looks like we have a couple in the chat here.
Okay.
So we got those.
There we go, we can see it now. Jake, could you read the question?
I'm appreciative of care that Augusta Health is doing for our residents, for my long-term care facility. When we bring in new residents, giving us a COVID-19 test has been hugely helpful in our success and preparation. Are vendors allowed back into the hospital in order to see our patients or potential residents? What do we need to be prepared for in order to complete those visits if allowed?
So Augusta Health is letting vendors back into the building that need to be in the building. If they cannot perform their duties, virtually, then we are allowing vendors. There is an application process that involves using the RepTrack program that you may already be enrolled in. You have to be able to tell the hospital where you are visiting for the day, like you have an appointment at to see somebody on the medical floor or at a certain office, and then after that you leave the building. And also there is a quick survey, just like many people are doing in the community. And we do daily for every person that walks in the hospital. We're doing visitor screening. So there's a similar process for vendors where if you've had a fever or any symptoms, we're going to ask that you defer your visit for the day.
Okay, next question.
Other than keeping ourselves as healthy as possible, what can we, the community, do to support Augusta Health?
Great question. That's coming from Kelly Burdick, and we thank the American Shakespeare Center for helping Augusta Health with some community messaging. They did a mask advertisement, which was wonderful. So really being masked, when you think of more of a one-on-one approach, mask modeling is so important. So if people see us wearing masks and see us just not dropping them at the first moment we can, and I know masks I know can be uncomfortable. Nobody wants to wear a mask. I do not like these, and I don't want to wear one, but I know this is how I protect you. And using that positive feedback and providing some people positive feedback when they have questions is important. Also, you listening to this webinar is so helpful because you're going to hopefully have some facts that you can carry in your back pocket and help with just some community education.
So I'd just like to add to that, Dr. Baracco. If you go back and look at the statistics that we went over, and that our admissions are basically between 5 or 10, and all the monitoring that we're doing to be able to take care of both populations, that's how you can actually help in the community. Because if this was to get out of control, we have to scale back in terms of the services that we provide to take care of all of our patients. And so as it might seem relatively straightforward and simple about you staying healthy and community staying healthy and supporting that environment, it is so important to us because we want to take care of everybody, and we don't want to be in a position where we have to scale back our services. Okay, should we move on to the next question? Okay, next question. What have we done well locally to prevent the spread? Move on to the next one. There we go.
Yeah, I'd share that it's not one thing. It's a really large collective effort that's been done by our community. It's been a very hard 4 months. There's a lot of personal and family sacrifice and a lot of hardship going on. And I don't think we credit ourselves very well for how successful that's been and how much of a difference we're making. among the things that have already been talked about that are on this list, the mask wearing, the social distancing, the stay-at-home orders have big impact, and we have good data to support that. There have been tremendous efforts in the community to figure out how people can work from home, and that's very helpful. I see a lot of education efforts, not only from Augusta Health, but others in the community. We've been standing up telehealth efforts. That's sort of changing our business model to continue to provide care, but also be safe at the same time. We're collaborating with agencies in the community, with businesses in the community, with long-term care facilities, and those sort of step outside of your own business and form a partnership to help with COVID really makes you a lot stronger as a community. The work around being consistent and continuous in our communications has been huge. You can go on to the VDH website and see some of the modeling. The Department of Health has modeling they're doing in collaboration with UVA to show how much impact our community's efforts have had in keeping people safe. And we peaked in terms of new cases in that first peak around the end of May, and the impacts of all these efforts in the community, that modeling estimates we've saved over 12,000 infections locally. Equally valuable, the work of the long-term care facilities to be very cautious in protecting the vulnerable people in our community who are most at risk from a COVID standpoint has been very successful, and it's tremendously hard work to care for folks in a long-term care facility or an assisted living facility and have all that isolation and figure out how to do that and meet patients and families' needs. So a lot of great work is occurring there as well.
Is there any questions in the chat for my voice? Okay. Not seeing any new questions at this time. Why don't we keep moving? As school starts, are there additional steps parents can take to keep kids safe?
So looking at steps that parents can do to keep their children safe, masking or face covering of children is so important. And children can do this. I have a young child in my home who actually is probably better about it than the older child. He just puts it on and he'll wear it from the time we get into the car until when I drop him off at his daycare program. So children can do this. If they can't, try a face shield. There's many face shields out on the market designed even for children. And so we need to look for mask comfort, of course. That's going to be important for younger children. But that's going to help keep them safer in school and keep the staff safe. If everybody's wearing a mask, then the safety increases. Asymptomatic children are not typically considered super shedders. So I kind of touched a little on statistics before. We're learning so much about children right now throughout the world. Many studies replicate throughout the world that the children are not the super shedders or the ones that are the super transmitters. So it could happen in a high incidence area, especially if there's irresponsible behaviors. But what we've seen in the countries that have lower incidences of coronavirus, many schools have reopened successfully. The outbreaks have been seen when there's a high burden of community disease, and most children, the highest risk of a child getting disease, unfortunately, is in their home from their parents. But we do know that age group I mentioned before, 0 through 9, appear to not be the shedders, but after the age of 9, the risk goes up slightly more for every year until you approach about the same rate of transmission in the later adolescent years, and that we assume that's because of the social nature of that group and some of the behaviors, them being able to get out into the community more, whether they're working and other social factors or dynamics that are making the older adolescent group kind of equivalent to adults. If you are diagnosed with COVID, it's important that you call the school and to report to the school that you have been infected. Keep your child at home to prevent spread to the school. As I just mentioned, the highest risk for those children of getting coronavirus and then spreading it to others in the school is from getting it from other people in the home. If your child has underlying medical conditions or anyone in your family, it is not too late or too early to create some kind of safe plan if a family member becomes infected. Some people have the luxury where they can quarantine themselves into an area of the house. Some people don't. But this is where coming up with a safe plan, or the safest plan, I should say, is some food for thought and best practice. Even if the person, I know I've read some physicians, I read a lot, or listened to a lot of podcasts and reading a lot, but I know physicians that have had COVID wear masks in their home, and they've been able to kind of quarantine into one bedroom, wear a mask, and not transmit to family members. That's not an always situation, but that's a safer practice if you're able. Of course, that becomes difficult if you have younger children. Teach your children good hand washing, no sharing snacks and supplies in school. Make sure that your school has a safe plan, and I know that Augusta County and the city of Stanton and Waynesboro have been working very hard on their start plans for the school year to prevent sharing, especially, and ways to physically distance children in the classroom. Walk or drive your children to school if you can. Really, it's preferable to keep the overall number of children low on the bus. So if you have the luxury or ability that you can get your children to school in your own vehicle or by walking, that's preferable. Other comments, we have Dr. Cornegie here from the Health Department. She might have a little more from that perspective.
Sure. Yeah, we've been working with all of the schools within our district on safe back-to-school reopening plans, and they all emphasize the things that we've talked about: the social distancing, hand washing, face mask wearing, environmental decontamination. I think the big role that parents are going to play is in the screening process for their kids, because logistically speaking, the schools really can't take temperatures on all of the kids. They can't do robust, screenings before school starts. So making sure that you're doing that as a parent, checking kids' temperatures, checking for those really subtle signs of COVID, things like loss of taste and smell, or some GI symptoms, or some, really mild respiratory symptoms, making sure that you don't have any concerns about your child going to school sick is going to be really important in keeping the communities healthy.
Okay, do we have any questions in the chat boxes, or anybody who wants to ask a question on this section? Okay, seeing none, I think we're going to keep moving. Next question: how do we keep our employees, families, children, and ourselves safe? Why don't we go ahead and dive into this section? I think there's a lot of good information here. Let me just jump in here, because I had thrown this slide in, and so it's only fair to our panelists probably wondering where this came from. In the reopening guidelines for America, this was some of the initial guidelines that were set forth that we need to consider as employers as we reopened our country. And so they dealt with issues around social distancing, temperature checks, testing, isolation, sanitation, use and disinfection, and business travel. So those were some of the premises of these guidelines. You can refer to these guidelines, and what I think we're going to do here is take a deeper dive into some of these concepts.
It was touched on briefly before, and just to give a little more detail, we know that the COVID-19 infection You know, the severity of what people experience varies based on risk. And so thinking about your workforce and who might have higher risk in your employees is very valuable. The strongest risk factor for being hospitalized with COVID or even passing away from COVID is elderly age. So folks over 60 have higher risk. And then there are more papers coming out that particular chronic health problems seem to be tied to more severe COVID, and diabetes is an important one, heart failure, being very overweight, and then patients who are immune suppressed. An example would be cancer patients receiving chemotherapy, but there's other types of immune suppression, very important group. Folks with chronic lung disease, particularly COPD, often will have exacerbations in the setting of COVID infection, and there's some data now that the folks who are on dialysis, that often have there's a lot of chronic health disease with that, but is a higher risk. So being able to talk with your employees and think about how who works from home and who is set up in the work environment to be a little more cautious. That's a good list to work from.
Universal masking key points. So I do want to delve into masking. We talk about it a lot. Everyone's heard about masks, and so there's a lot of misconceptions. Hopefully we can provide some information today about that. So we know some key pearls are that universal masking mitigates asymptomatic and pre-symptomatic transmission of COVID-19. Unfortunately, this is why it continues to spread. If we knew that the day that we developed symptoms was the day that disease was transmitted, then it would be very easy to keep people distanced. But the problem is that the disease onset is 1 to 2 days before symptom onset, and that is what is driving transmission. Masks can help prevent symptomatic individuals from causing super spreader events. We know, we've heard the stories about the choir singer that spread it to the whole entire choir, and we've also heard the good stories, and this was before we knew about the efficacy of universal masking. We've heard the good stories about the hair salon, where there was somebody with coronavirus cutting 140 clients' hair, and everybody was wearing a mask. The person with coronavirus was wearing a mask, and all the clients were wearing masks, and nobody developed COVID, which is wonderful. Masks alone are not the answer, or we would be able to say, okay, everyone wear masks, and we can continue as usual and have large events. We know that is not possible, unfortunately, but we do know they are effective, especially when we have a high rate of adherence or compliance. All employees and visitors should be required to wear a mask the entire time they're on your premises. If you own a business, it's so important to enforce this with entry screening in all common areas. Employees should continue to mask in the presence of other staff members, even in shared office spaces, workrooms, and cubicles. This is a large one, and it's a sore spot because we think of some of our coworkers like family, and we have now physically distanced ourselves, and we're finally getting back to work, and we get used to being around them, and we want to be around them like family. But unfortunately, we can be around them, distance, but really, ideally, even if you're in a cubicle, because in most businesses don't have air circulation like a hospital negative pressure room, we need to encourage mask in the presence of all other staff members. And we should avoid eating meals close together. Another thing that is so difficult for coworkers. We love to bring food in for each other. Again, we're like families and we want to share things, but unfortunately, now is not the best time to be doing that, and also that makes you tend to breach your mask use as well. So ideally, if you can space out breaks, eating breaks, have employees eat outside if possible. I've seen some businesses that get a picnic table outside still. You should be distanced. This is the best practice. So, big question I get, what's better, a face shield, a face mask, what should we wear? I love this picture. The best face covering is the one people will wear. That's step one. We know in truth, we know that surgical or procedural hospital-grade masks are better than cloth masks. We also know that we need to preserve those for our healthcare workers. What I can say about masks and face coverings is if we have a face covering, and cloth masks are probably range about 60% effective, but if both parties are wearing a mask, the efficacy goes up enough that the transmission of coronavirus can decrease enough to help potentially, if we had strict mask using and physical distance, potentially end a pandemic. Because we know coronavirus is transmitted to about 2.5 people every time somebody's infected when nobody is wearing a mask. So this next picture is helpful for everyone. We did take it from community medical centers. We found it on the web and felt that it was useful to share. It's one of the better pictures that I've seen. People are asking, why do I need to wear a mask if I'm healthy? And you can see the risk of transmission from a COVID carrier to a healthy person when nobody's wearing a mask versus when a healthy person's wearing a mask. The COVID carrier actually, it's important that their respiratory droplets are caught in the mask, and that is an important scenario where if the COVID carrier is wearing a mask, that places you at a lower risk than you alone wearing the mask. But the smaller risk, and when we get into extremely low risk, is when both parties wear the mask at the bottom. So this is a great pictorial. There are many similar ones on the web to share if people find this helpful for showing employees or coworkers the importance of universal masking. And here is another great diagram showing how quickly can germs spread. It's using your breath versus cough versus sneeze. Sneeze, unfortunately, is the most risky scenario of the three as far as what creates, I don't even want to say aerosolization. Really, the true airborne portion of the disease really is more in medical scenarios. I know that the World Health Organization is very controversial amongst infection preventionists. The World Health Organization announced this is airborne transmitted, and it is to some extent, but mostly we know it's mostly a droplet disease, and droplet diseases are prevented by wearing masks. So we can decrease transmission significantly with simple mask use. Any other comments, Dr. Cornegie?
Yeah, no, just definitely using the mask, and as the graphic illustrated, the mask that I wear protects you, the mask you wear protects me. So if we both do it, our risk of transmission is just going to be markedly lower.
This is another picture. This was taken from Akron Children's Hospital that we found very helpful to help address misconceptions and questions that we frequently receive about masking. So here are just some common things to avoid. Please wash your hands before putting your mask on. I know we have all seen in the community the mask worn inappropriately with your nose uncovered. Really, in order to be effective, you need to cover your nose and your mouth. Avoid touching and adjusting the mask. That is that's challenging. So you have to find the right mask that works for you. Back to that other picture of which one works the best, the one that you can wear that fits, the one that can keep your nose and your mouth covered. Mistake 4, masking too late, removing it too soon. And then the last one is reusing old or dirty masks. How should you care for them? Simple washing. We know this is not a virus that lives on surfaces for prolonged periods of time, and just common using your washing machine is adequate. I have not heard of any special things you need to do with your cloth masks to help as far as the cleansing process.
Yeah, I wanted to speak to when can a patient who has a COVID-19 infection return to work. And the guidelines for that actually changed this week. That's the nature of COVID. We're on a path, and then we learn more, and we find a better path. The new guidelines are that a patient is safe to return to work. We no longer think they're contagious with COVID, based on the time of illness and how sick they were when they caught COVID. And what the CDC is recommending is most of our patients have mild or moderate or no symptoms for COVID, and then there's a group that has really severe symptoms. And if you're in the mild or moderate group, then the criteria to say you're safe to come back to work are 10 days have passed from when your symptoms first appeared. The last 24 hours you've had no fever, and you're feeling better from a cough and shortness of breath standpoint. We call this a 10+1 rule, 10 days from onset of illness, 1 day without fever and feeling better. That's the criteria to return to work for the majority of patients who will be diagnosed with COVID infection. There is a group that has severe COVID infection, and this is defined as either having a new oxygen requirement, you need supplemental oxygen because you're that sick, or you're in the hospital with an unstable illness, and there's more details to that, but that's the ballpark of it. And we also put in this group people who have immune suppression. We count them in the severe COVID, and for them, we know that they can be sick longer and can shed virus longer. And there's some data behind what they're recommending at the CDC, and that is a 20+1 rule, which means 20 days from when your illness started. That's a long time. The last 24 hours, again, are without fever, and the patients are reporting that the cough and shortness of breath symptoms are improving, and that's the 20+1 rule. Some of our patients get diagnosed with COVID and they don't have any symptoms and they feel well. They're the asymptomatic carriers of COVID virus, and they would follow the 10-day rule. 10 days from when they had maybe they had a positive test because they went for a pre-procedure testing. We know they have COVID. They're feeling fine. They should be at home for 10 days, and then they can return to work at that point. One of the key points about this, and a really big change, and it's coming up a lot in our community and around the country, there's been a call to test people to prove that they're safe to return to work. And what we're finding is somebody who has COVID, and then we repeat test them at 10 days and 14 days and 3 weeks, and there's a fairly good group of people that will be better, no longer sick. You actually can't catch viable virus if you do the study to look for it. But when we do the PCR testing, the testing type we have for COVID, they're still testing positive weeks out. And
months out too.
Months out.
Just to frame it, because if you're thinking about your employee coming back to work months, sorry.
Yeah, no. And so I think, one, that gives us the false understanding of whether somebody's safe to come back to work, and the call to test lots of people to prove whether they're safe to come back to work is also a significant challenge in a time where we don't have as many tests as we'd ideally like, and we have longer wait times and turnaround times for tests. So I really like that they've changed to say you no longer prove somebody's clear by doing a testing strategy. Go with their clinical symptoms and the time of illness to determine when they're recovered from COVID.
If I can make one dovetail comment, and when people are returning, they still need to wear a mask. So that's another reason why that test doesn't become as important. We are learning, or that we don't know if the timeline of when people can become reinfected. There may be a period where if it was at the very end of that 10-day period, they still transmit, but if they're wearing a mask, they won't transmit. So masking still remains essential for everybody, universal masking.
Do these rules apply to close contact in the home? That's a good question. So for COVID, we define a close contact in a specific way. So if you are within 6 feet of somebody for more than 15 minutes, we consider that a close contact where you've had a meaningful exposure and are at risk for coming down with COVID. We also consider a close contact anybody living in the home with you. And so if I catch COVID, the people who live in my home are now close contacts. And the recommendations to prevent spread are that those people quarantine at home for a window of time to make sure they don't get sick. So if somebody has a close contact, the rule is they quarantine for 14 days. It's a significant, because we know, unfortunately, COVID, the onset of illness can be 2 days after you're exposed, it can be 13 days after you're exposed. And that's what makes this really challenging. And so to limit spread in the community, the safe practice is if you've had a true exposure, a close contact, then the rule is you need to be at home for 14 days to know that you're not going to get sick. And that's really important for a workforce. An employer who has a staff and an employee says, I've actually had a contact. Maybe I got called from the Department of Health that I've been exposed to COVID and I need to quarantine. That quarantine window will be 14 days. You can't test yourself at day 3 or day 7 and say, oh, I don't have it, I can come back to work now, unfortunately. Because we know that you may test negative at day 5 and still come down with it at day 13. So the quarantine period is 14 days.
And the quarantine period, unfortunately, for household contacts of positive patients, are having continuous exposure to that positive patient. So their quarantine period starts when the positive patient comes out of isolation. So for household members, a quarantine period is really going to be 24 days, unless that positive patient can totally isolate away from the family, and that would be something like a garage apartment, a mother-in-law suite, not sharing any common spaces, not sharing kitchen spaces or that kind of thing. So that takes a lot of families by surprise. It takes a lot of employers by surprise, to just being aware of those recommendations.
It's a hard one. Yeah, to help get a sense of how do I think about my employees if they're exposed or have COVID, I thought it would be helpful to just go through a couple examples. So let's say that an employee shares that they feel sick today. They have a fever and a cough, something that could potentially be COVID. Well, certainly the immediate answer is you need to stay at home and not come to work. And you need to get assessed by your physician or maybe at the Waynesboro Assessment Center locally to be tested for COVID. And then how long you're at home really depends on whether COVID was ruled out. If you have COVID, then it's what I just described of the 10 days, and assuming you don't have a severe case. And then if it's not COVID, if it's a cold or influenza, then it's you recovering from that illness before you return to work. If an employee calls you and says, I actually tested positive for COVID, I have COVID infection, then the stay-at-home rules are what I just showed on the slide. So it's, for most people, going to be 10 days. For people with severe illness and an oxygen requirement or getting hospitalized very sick, it's going to be 20 days at home. And then as Dr. Cornegay was just sharing, so the employee says, I've had a close contact with somebody with COVID, then that's a 14-day quarantine. And if in that window they happen to come down with COVID, because they're in the window of possible infection, then they'll also be at home from that point for the 10 days. So this can be a long window when you've had an exposure that you would not be able to come to work. And then case, let's say your child has a close contact and your child is under quarantine. Well, the child's going to be at home for 14 days. If they develop COVID, you're now a close contact and you're at home for 14 days. And then whether you got sick or not would determine whether that was longer. So I think the important thing, it's challenging to think about the cascades of this a little bit. But as a workforce and as employers, realizing that exposure to COVID and coming down with COVID can mean that people have to be out of work for a fair amount of time or work from home. Questions about that?
Do we have any questions for our panel?
Change for those of us who have been positive and recovered. Boy, we don't know the answer. They don't change, but I'll let you guys answer that.
I think, the reality is if you're positive and recovered at the same time as other family members in your household are positive and still ill, you can look at it a little differently in that you have recovered and you can return to work as long as you're using appropriate hygiene and just being very cautious and wearing a mask. However, caveat, there's some nuance because there is a potential or possible potential, and we'll learn more. This could, in 3 months, you might think, gosh, you told me the wrong thing, but we just don't know. We think people may be able to get reinfected. Viruses mutate a lot and rapidly. So if this mutates, then if you've had coronavirus, there's a potential 3 months from now that you could get reinfected with coronavirus. So in that respect, the rules as far as quarantine for exposure to COVID-19 do not change. But certainly, as we learn more, you might see that health departments update that in the next 3 to 6 months as well, and then you'll have more guidance.
So we have one more question to respond to. We hopefully can wrap this up in the next 5 minutes or so. So if you can bear with us, we'd love to get through that question, which is, what do we need to do to be prepared for another wave of COVID? And there's 2 slides that we have here, and I think actually the second one is probably interesting. I think the first one covers a lot of the information that we've covered so far here, but I'm going to turn it over to my experts.
Step 1, get your flu vaccine this fall. So important. We predict that co-infection could increase your risk of complications. It could also overwhelm our hospitals. It is so important. There's going to be a lot of flu drives this fall, and we're trying to figure out how to best do those, whether it be drive-through flu vaccines, ways that we can keep physically distanced. But please get your flu vaccine. Call your primary care provider to ask how and when you can get it. Usually late August, September is the peak time. Create a strategy or plan for your workplace. If the community is asked to shelter in place again, it's not too early to create that plan. Can you work from home? Perhaps you already know some strategies that worked before and things that you need to change if this happens to you again. Maximize opportunities to perform work and meetings virtually and work from home. And then lastly, again, universal masking is essential. Next slide. All right.
Yeah, I just want to make the point that we've actually learned an awful lot about COVID-19 virus infection and illness. Our biology our understanding of it is growing, and there's just great lessons from that. We've emphasized very strongly the importance of mask wearing and social distancing because we know this spreads via the respiratory tract. And so steps you take to work from home and do virtual meetings and distancing and work, they're all hugely valuable. COVID-19 virus has killed a bunch of different ways. The alcohol you put on your hands, the bleach and other FDA-approved disinfectants that you put on your high-touch areas, the high temperatures in the laundry, these kill the virus. And so disinfecting high-touch areas regularly in your home, in your school, and in your work environment. We talked about how this virus has a long incubation period, meaning it can be 2 to 14 days from exposure to getting sick, and that's why we quarantine for 14 days. We're following the biology for that. We know that COVID has a wide range of illness. Some people are going to have no symptoms, some people mild, and some are going to have life-threatening infection. We can't rely on symptoms to tell us who's not contagious. That's why we do universal steps here, like masking for everybody. And we should continue to pay attention to those groups in our community and in our workforce who are vulnerable, who don't have resources, or who are at risk for having severe illness. That can occur through employers, and we're certainly doing that at the health system, and I think that's continuing to look at who's most at risk. And all the work we've been doing as a community is really protecting those people. And then this is a long illness for some. We have patients who, when they're hospitalized, they're sick for weeks. And realizing that patients and families need strong support systems in their home and strong support systems in their workplace to recover from COVID.
So we just would like to leave, first of all, thanking you for spending all this time with us this morning, and hope that you found that this to be informative. We'd be happy to do this and work with your organizations individually. If needed, you can reach out to me, you can reach out to Courtney, and we'll get you connected with the right resource. We'd also invite you to join us with our Mask With Us campaign, #MaskWithUs. You can do this on your Facebook account. Take a photo of yourself wearing a mask and post it. There's instructions for this here that will be in this packet, and certainly this information can be distributed to you, and so you'll have more details about that, how to join the #MaskWithUs campaign. You can also find out about it on our website. So we hope that you'll join in and mask with us. And with that, I think, is there any other questions that any members have, or anything in the chat box that we want to make sure that we cover that you'd like to ask at this time?
I don't see anything else in the chat. Does anybody else have any questions as we're wrapping up here?
Yeah, somebody commented that this was very helpful, and if you have any comments about this information, what was helpful, what was not helpful, if you wanted to include that in a chat, that would be fine too, because as we communicate with the community, we always appreciate the feedback in terms of was this helpful, was it not. It certainly is used to help direct our communications in the future.
Awesome. All right. Anything else from the team there at Augusta Health, Mark?
I think our panel of experts have done a phenomenal job, and I appreciate that they were here and offered their expertise. This was greatly appreciated.
Yes, it was. It was wonderful information. Again, we really thank Augusta Health. You guys have been such a wonderful resource and taking care of our community, and we know we'll all be looking to you more throughout the next few months. We hopefully see this thing go away. Thank you to everybody for being here today. We will post the recording and the slides on our website a little bit later today, so you can watch for that. If you have any questions, you can always visit Augusta Health's website for information, more resources. They're posting things there really often that are really helpful to all of us as a community, especially as we go forward. We'll be looking to them to help us stay safe and stay well. So thank you all so much for being here today. Thank you so much to Mark and Nicole and the team at Augusta Health for being here with us. We appreciate you so much. And everybody have a wonderful rest of your day.